hope everyone is good uh, this afternoon or evening for someone, or even morning. We will have a few more minutes so we can let everybody in. And as we do that, I will say a few words about the house rules, and then we can start. Welcome to Finn's webinar about women. I'm Mary Pablo, I'm the president, and we are excited to have with us Dr. Hopkin, who will explain the results of the questionnaire, a little bit big this time, but a lot of you have answered this questionnaire about Fabry and female, and he will try to explain a little bit the results and to give the insights of what people are trying to say and where we are with Fabry and females. I would like to ask you to write down on the comments if you have any question when it pops up to your mind, so we can have a discussion later on. And the only reason I will not use any names, even though thank you very much for someone that I already know. Thank you for being here. Is that we are recording this webinar, and in order to be able to post it later on our YouTube channel, we should keep the privacy. So that's the reason. It would be better to have Dr. Hopkin explain to us the results, and then we will have time to have a discussion, I think. Um,
All right, I will share
so
then.
yeah, you can share. So I can. Yes, I was going to ask Charlotte if we have anyone else waiting. So I would like to first thank you very much, Dr. Hawking, for being here, for doing this for us. For anyone that doesn't know, Dr. Hawking, he's an excellent expert on Fabry disease. He's a pediatrician, but he treats adults as well, and he's in Cincinnati Hospital, pediatrician hospital. Sorry. I will give the floor to you, and you can share your screen, and I will please close your microphones, and you can start. The floor is yours.
All right. Hey, can you see my slides? I am very happy to be here. I am honored to be given the opportunity to talk about this. And as you will see, this is clearly a very important topic. Uh, The survey itself was a worldwide survey for women with Fabry disease. It was designed to help figure out what the real lived experience is. And 88 people completed the survey, and they were, as you can see on the slide, from literally all over the world, Europe, Asia, Australasia, South America, and North America, all included. Let's go to the results. So it's good to know the population we're talking about. In this case, most of the women were between ages 45 and 65, but we did have people older and younger than that. The youngest was 15, oldest was 78. And this gives you an idea of where everybody was from. You can see that there is a little higher representation from Australia and the UK. in Sweden, but really all of the world is covered, which means this is probably representative of women with Fabry disease throughout the world. So what age was the diagnosis made? There's, again, considerable variability from being diagnosed at birth to being diagnosed at nearly 70, um, with the majority being in their 30s and 40s, which is comparable to what I would have expected, um, but as you will see in a moment, is not optimal. So um, most people had symptoms before their diagnosis. In fact, 82% or 73 of the people who filled out this survey had symptoms prior to diagnosis, and the number of years of symptoms was quite variable, but again, it was quite high. Uh, more than um, more than half of the respondents had more than 14 years or 14 years or more with symptoms prior to getting a diagnosis, and a lot had closer to 30 years. The biggest delay between first symptoms and diagnosis was over 50 years. That's the biggest delay for a single person I can understand, but the more than half having symptoms for um, a decade and a half is problematic at best. So why did people get diagnosed? Um, a lot of people, it was family. A family member was diagnosed. Uh, and the family connections were father, mother, son, cousin, a big variety. Some people had physical findings. The eye whorls were noted. Some had major health events, stroke and heart disease specifically. It looks like one had a newborn screen. That is probably going to increase with time, but still is a little unusual at this point. Um, the One of the things that stands out to me is there were some people who had diagnosis made based on their symptoms, but more often other reasons. And that tells me that the symptoms probably were not being evaluated, or at least that Fabry disease wasn't a consideration. So the confirmed diagnosis came as one would hope through genetic testing, because that's the most reliable testing, particularly for women. Um, it is more reliable than the other methods that might be used. Um, about half of the women in this survey had classical Fabry disease, and 16% with non-classical, and then a lot did not know what type. And some of that could be that their mutation hasn't been classified yet. So how did they receive the confirmation of the diagnosis? This is genetic testing. A lot of people did have other things done. There were enzyme level measurements, skin biopsies, or biopsies of kidney. Um, so there were other things that were done to confirm the diagnosis. I don't know how for you, I don't know how it was done. In my clinic, we usually order the genetic testing and the enzyme level and the biomarkers all at the same time, so that if scrap a chance to address them up front. So the symptoms being experienced, again, there's a big variety here. You can see in the other category there are a lot of things, and then you've got the most common ones are fatigue and heat and cold intolerance, but pain, um, especially if you put pain and burning sensation together, that would be another very big category. Exercise intolerance, ringing in the ears, and there's just a lot of variety of symptoms. And these are not symptoms that I think most people would just ignore and not pay any attention to. So some specific organ involvement, heart is probably the most important one because it's the number one cause of death for women with Fabry disease. Um, but kidney problems are also highly represented, especially protein in the urine. Now, proteinuria is important even if you do not have renal insufficiency. So if your kidneys are filtering normally, but you have protein in the urine, the protein in your urine damages the kidneys and some risk for kidney disease. There's also a correlation with the amount of protein in the urine and the risk for progression of the heart disease. So I think that paying close attention to those is very important. Irregular heartbeat with cardiac arrhythmias is also something that is very important because especially if you're having runs of rapid heart rate, that is a life-threatening um, uh, event, potentially. Um, Heart failure and stroke are also very important. In this study, they were a little bit less common than the irregular heart rate or protein in the urine. That might be because they are later manifestations, and so things are being picked up before end-stage disease. So again, number of things in the other organ category. So symptoms with the biggest impact on life and quality of life. It's interesting when I go to meetings about Fabry disease, people talk a lot about heart disease, kidney disease, a little bit about GI symptoms, and quite a bit about pain. And those are the main topics. And yet, the number one impact on quality of life in this survey um, is fatigue. And interestingly, we did a study on women with Fabry disease compared to women in the general population, and fatigue was also the number one issue in that study as well. And in studies of combined studies of men and women, fatigue was also um, one of the top one or two symptoms that people reported. So that's something that clearly we need to pay more attention to. Again, a wide variety of things. Um, and some of them we will not be able to see, like heat and cold intolerance, um, burning pain in the hands and feet. The doctor can't see that. They will only be able to know that you have that if you talk to your doctor about it, because there aren't physical findings associated with those things. So, what things um, impact the risk for symptoms? So, hot weather appears to increase symptoms substantially. Um, Exercise also increases it. I am curious, and hopefully we'll hear from some of you when we open up the discussion about whether or not if you exercise on a regular basis, does that help you tolerate the exercise better? Some of my patients have reported that when they start to exercise, it triggers symptoms, but as they get into better shape, it this exercise related symptoms tend to decrease a little bit. Um, Menstrual cycle and work are also factors. With work, I am curious to whether that's stress related or is it the physical activities that you have to do at work that are doing it, that are causing it. Other things that have been noted to um, increase symptoms, going through puberty, um, the pregnancy is an interesting one because we have some people getting better and some people getting worse. Um, Menopause, it looks like more often than not, it's getting worse, and that would be consistent with my experience and what people tell me in my clinic. And then aging um, increases symptoms. One of the things that has been asked in the Fabry disease experts meetings is how much of that is symptoms that are Fabry disease and how much of it is just symptoms of getting older. And that's another thing that we could potentially discuss. So, how many people reported being on treatment? The majority of people who filled this out were on treatment, but a quarter were not. And then one of the things that was asked, well, why not? And if the reason is I don't have any identified health problems, that could make sense and that would be acceptable. Um, if the reason is that I can't access care, which was one of the things noted, um, that's to me not acceptable. I think we can do better than that. Um, so I am again curious about that. Um, Financial and insurance reasons have been cited, although in this study they do not appear to have been a major driver. The time commitment can be quite big. And then, as you can see, there's a number of other things. Just the burden of care, I think, is a big issue. And I have had multiple women say that they just can't take the time out of their lives um, to do enzyme infusion. So if they are not um, if their mutation isn't responsive to the um, oral medication, then they have opted not to be treated. I worry about that because sometimes the damage that we see um, is not reversible. So, what treatments are women taking? Um, there's a lot of people who take medicines for the symptoms or medicines that are not specific to Fabry disease. So, again, a quarter of people were not on treatment. That means about three-quarters were on treatment that was specific to Fabry disease. Then you have people taking um, or getting treatments for the other specific things. Heart problems and pain being the most common, but a number of other things. Um, there's increasing attention being paid to some of the renal protective medications, especially for people with proteinuria. And I think that is a very important um, part of this. Um, I think it's also important to note that like cholesterol, which is in the other category, is not something that is directly related to the Fabry disease, but it is important to take care of the whole body. I have a number of patients who have things like high cholesterol or diabetes or other problems. And if we don't treat the Fabry disease and the other problems, they don't seem to benefit in the way that we want them to. So, challenges experienced. And this is where I think the thing that got my attention the most, half of the people had challenges in getting a diagnosis, and 28% had challenges after the diagnosis with getting the appropriate monitoring or even getting access to treatment. And it's not a new idea that women with Fabry disease should be treated at this point. That's well established. And so, what are the reasons that people are having difficulty? And again, if you look at the answers in the other category, there is a lot going on there. Um, People are getting diagnosed, but then no follow-up is scheduled. People are having to explain to their doctor what they have and be their own expert in getting their treatment. And that, I think we can do better than that. Getting insurance coverage has been a challenge is noted as a challenge on this list. Um, but just a lot of things have been um, challenges, and they are mostly related to the healthcare system. And I find it interesting that that seems to be true in all of the systems. So Um, Now this is just looking at life stages and getting access to the the treatment that you need, and how do you get treatment. And it looks like it's kind of throughout life, adolescence and puberty, starting a family, going into menopause. Um, I'm not surprised that some of the doctors would be uncomfortable with addressing the Fabry issues during a pregnancy because there's not a lot of data on that. The data that we have is that treatment, especially for those on enzyme therapy, treatment can be given um, at least reasonably safely. Um, but there's a lot of things that people were just told, we're not going to treat this, and that is it is a problem because there are treatments, and at each of the stages of life that are listed on this slide, there are things that you know things that can be done, and we have some idea of what to look for, what the symptoms would be related to Fabry disease, and things that we can do both for the symptoms and for the Fabry disease. Um, Now, given fatigue, anxiety, and depression are all significantly increased in Fabry disease compared to the general population, um, and one of the things was that being addressed? And it looks like it has been for something approaching half of the people. Care was offered. I think that is a good thing. Genetic counseling was offered, um, but there's also a lot that isn't being offered. So um, again, I'm curious as to your experience and your thoughts on how to get better access to these resources. And one of the things that we struggle with in the US is getting families to accept things like the psychological counseling or treatment for anxiety or depression. And your thoughts on that would be greatly appreciated. Um, I also find in the other category, 10 people responded, no help offered. That, again, is disturbing to me. So, satisfaction with being monitored it is actually not too bad. 2/3 of the people were satisfied or very satisfied with their treatment. Um, and that's for both blood tests and the imaging monitoring. So hopefully that is a good sign. Um, the 35% who scored doctors highly on knowledge is great, but there's a lot of medical doctors that don't know. And I don't think it's included in this study, but a lot of people have told me that their doctors not only don't know, but have said that they don't think they need to learn about Fabry disease. And if they are seeing a patient with Fabry disease, I think they clearly do need to learn. So, how well are the patients relating with their doctors. Um, a lot of people have had times when the professionals were unwilling to provide treatment, um, or to help them overcome barriers to treatment. A lot of people do have doctors who will listen to them, but a quarter or more do not, and uh, many people feel unheard by their doctors. I don't know in the rest of the world, but I know in the United States, the average time that the doctor spends in face-to-face contact with the patient is probably 10 minutes, 10 to 15 minutes at the most. And that is problematic when you have a rare disease that has multiple system involvement and your doctor doesn't isn't familiar with the disease. So the doctors not being interested in the disease was the biggest problem. And then not enough time, which is what I was just talking about, is another issue. And then we have the others category. Um, and there's again, a variety of things that make it hard to get plugged in and to get the care that you need. So this is another one that I find a little troubling because we know that hormones are important in Fabry disease. Both men and women have hormonal abnormalities, and in as has previously been mentioned, the menstrual cycle and reproductive issues impact the progression of the Fabry disease. So only 13% have discussed these issues with their doctor. Um, and of those that have, most of them were told by their Fabry doctor that they couldn't help them. That shows me that there's a big need there, um, and that we can do better than that. The medical care system needs to listen better, clearly, but I think also we need to just have more open conversations about issues like hormones and menopause and even pregnancies and their impact on health in general. So, changes during puberty, we don't have time to go through all of these in great detail, but there is quite a bit here. And it looks like there were a lot of changes in puberty, and for most people, the symptoms seemed to become more prominent as they went through adolescence. Impact of Fabry disease on daily life. Um, well, the majority reported negative impact on work and career and negative impact on mood and emotional health. And that's independent of the physical findings, and any physical limitations that they might have. So those findings, again, strongly support the need for open conversation and to consider having treatment um, for the Fabry disease if we have treatments that can in fact improve health and well-being, which the current treatments that we have, while they are not perfect, they do help with overall quality of life, and they help with protecting and preserving the organ function for at least the kidneys and heart. Recent publications indicate also an important um, improvement in protection from stroke. Um, so as I mentioned earlier, depression and anxiety are quite common in Fabry disease. In the general population, about 10% have depression or anxiety at a given time, and about 25% will have depression at some point. And so 73% is much higher than that. So then what do we do? So the people who filled out this survey turned to family members as the primary resource, friends next, and then um, other things. Speaking to a psychologist was actually a little bit higher than I anticipated it being, but not probably as high as it should be. I am glad to see people taking up hobbies and exercise because those are known to improve both depression and anxiety and have other benefits for both mental and physical health as well. So what would you like to see changed in the way that Fabry disease is managed for women? Um, there's a lot here. We will, again, not read this, but the biggest thing seems to me to be that we need the healthcare system to be more aware and to listen to the women with Fabry disease. Um, we also need to have better quality treatments that don't have as much of a burden associated with them. There is important work being done on that. And there's, in spite of 20 years of evidence being gathered and highly publicized that women with Fabry disease do have serious illness and significant symptoms and in many cases life-threatening complications, there's still too much of an assumption that it has to be mild in women. I think we need to have a better way of spreading that, spreading the truth on that. There are also some things that are um, still generally ignored. Lymphedema in women with Fabry disease is not getting much attention at all. It's getting a little attention in men, but probably needs more. So there are lots of things in the community that can be done. And I think part of that is going to be on people like me who need to make sure that the information is readily accessible for the uh, doctors that are the frontline providers. Again, more awareness in the community, and there's lots of things here. The importance of Fabry disease in females needs to not be compared to males with Fabry disease, but compared to what the women with Fabry disease would expect their health to be if they were um, if they didn't have Fabry disease. I think is a more appropriate comparison, and that the disease is clearly important in both men and women. Um, Doctors need to understand that not all of the symptoms result in visible illness, that the symptoms should be taken seriously when they are reported. Um, and that will require changes. Um, there are some things that we just don't know about Fabry disease at this time, and we'll have to work on that. That is the goal of having things like the registries for women or for men and women with Fabry disease. But we are still working on that. There are new discoveries being made, and there are actually some newer medications being developed as well. More research on Fabry disease and specifically on its impact on women is needed. There has been some developed now, but there's still some gaps. There's still a lot that needs to be done to really understand the drivers of the disease and why women have the degree of involvement that they do, in spite of having some of the cells in the body in most women making the enzyme. So I don't think that the skewed exon activation is the answer. Exon activation, I think, is important and does play a role, but I don't think that skewed exon activation is the driver of the disease, because when we've looked for that, the majority of symptomatic women with Fabry disease do not have skewed exon activation. So care on for women with Fabry disease needs a broad focus. And there's a lot of things listed here with specific to females, menstruation, birth control, pregnancy, menopause, and then to all patients with Fabry disease, heart monitoring, kidney monitoring, stroke prevention, um, and some people also mentioned coexistence of other diseases, so things like polycystic ovarian disease, and I would add other things like diabetes and uh, arthritis, things like that to that. And this seems to be areas where there's a lot of frustration. The question is, how can we best address that and get that word out? One of the things that I think may need to happen that hasn't been done to my knowledge is reaching out to gynecologists and obstetricians with information about Fabry disease. And I think at this point that would be difficult because we don't have enough information collected. So thinking about ways of getting that research done will be important. Um, and we'll skip that one. Okay, so bottom line, from my standpoint, is that it's clear from this that one, women with Fabry disease have a serious disease that warrants treatment and that there is treatment available. That two, there is a lack of awareness and acceptance of that. Presumably, that is in part related to the idea that it's an X-linked condition, um, but that's been well studied, and the fact that it's X-linked does not mean that the women always have mild disease. Clearly, we need to work on communication with the healthcare system, and and I think the other major issue is that we need to work on access to the current recommended interventions and monitoring. And I will stop there and open up for questions.
Yes, well, thank you very much, Dr. Hopkin, for this detailed presentation of the results of the survey that we did. Um, you can stop sharing your screen if someone needs to see a slide. Maybe we can put this up again
Okay.
because we are seeing, your emails as well. Um,
Yeah. It's
well,
today.
yeah, no worries, no worries. So I would like to ask if anyone would like to speak. First of all, ask a question directly, or if not, then I will give some time to write something down. And as we are waiting, I would like to make some comment as well, and I will ask others to join me. So for me, my first. Oh, sorry, I didn't open my. Oh, Charlotte, can we open our video, our cameras or not? So I think that we need because the comments are tremendous on the other category, and it seems like I have the feeling that the women wants to document their experience with Fabry and they want to report all that it happens to them because they don't get the feeling that their physicians or their doctors are hearing them. And I read a lot of comments or responses saying that I was gaslighted. I was saying that it was hormonal issues or whatever. And this is disturbing because maybe we need to rewrite the textbooks for doctors about Fabry disease because, what sticks with someone from the very first, start of his career that Fabry is only a men-related disease. That's all. Never touch that thing again. And then it doesn't seem to change as other areas of medicine are changing rapidly because we find other things to support the new evidence. So is that I'm wondering, is that because we are women and we've been used to discard in a lot of cases as hysterical, let's say, or what can we do to change this feeling that we have that we are being not listened to? That's my main observation, let's say. And oh, we have a question. Was Fabry lungs female included or asked in survey? Fabry
It
lung,
was it
yeah.
was not included in the results of the survey, but we do know that lung disease is a part of Fabry disease. It is often labeled either as asthma or as COPD, but it's there is a Fabry lung disease. It has not been well studied in either men or women. It is known to be an issue, and with treatment, some people show improvement, and most will not have progressive involvement if they're on treatment. And it can be both inflammatory lung disease, which would be the kind that responds like asthma, and restrictive lung disease. Both have been reported.
Yes. And also, I do have to say that I agree with you, Dr. Hopkin, that it is disturbing that 14 years in average for the diagnosis, or I don't remember the years for treatment, or some reasons for not treated. Like my symptoms are not severe enough. My doctor say to start treatment, which is, we saw and we hear on congresses that as soon as possible you start treatment, the better the outcome, and that you cannot reverse the damage that you have in an organ like kidney or like heart. So yeah, I don't understand
Yeah,
this.
if you wait until the disease is severe, till it's interfering with your ability to function, then you can stabilize it, but you don't get back that lost function. So that is just not the right way to do it. I suppose if we got an expert in the economics and cost effectiveness of medicine, there might be some ways of saying, okay, we don't start as soon as we know somebody has the disease, because in some places that could be in infancy. Um, but we certainly don't want to wait until you've lost function, or till you have heart failure, or you've had a stroke and then start treatment. That is just not the right way to do it. We need to start early. Um, I would prefer to start people as soon as we have enough data to say this person's disease will progress, start them and not wait for them to have damage or loss of function.
Right. Yeah, of course, you agree. We agree. Thank you for the presentation. One of the comments, it's good to see how women with Fabry are doing worldwide. True, true. Is there any other question? Is this also clear to you? Of and how Dr. Hopkins explained it, so you don't need to ask, or you need more time to ask a question.
But what do you think,
Mhm.
as the women with Fabry disease, what do you think would be the best next step to raising awareness? How can we go about this?
Yeah, that's an excellent question. If someone would like to answer it, I have some ideas, but yeah, we're trying to do some things. At Finn,
Hi everyone.
hi,
Hi.
Tadevik. Oh, sorry,
Hi,
yes.
it's Tatvik. Hi. Thank you, Dr. Hopkin, for the presentation. And yeah, it's a lot to know and continuous learning, exploring, and the survey results help us to understand our conditions better as well. So thank you for putting that together. I wanted just to comment on the previous Mary's suggestion and add another layer that maybe not only the textbooks definitely, but also the regulations and the references, how nowadays the female patients are considered and based on which regulations they are treated. Because at least in Europe, there is a European regulation that says that there should be organ involvement for starting the treatment. And many patients are, let's say, having trouble to build their personal life or career or any situation and move in another countries or another states having the freedom, let's say, of the choice, because the regulations don't permit them to get the treatment in all the states. So I don't know how it is in US, in Canada, or other sides of the world, but I think large attention from the female patient point of view should be given also to the rewriting and updating the regulations. What do you think about that? Is there
I agree. One of the problems is that the policies are driven largely by the studies that were done as formal clinical trials. And at the time that the studies were done to get the drugs approved for Fabry disease, especially the enzyme replacement therapies, we didn't understand the impact that Fabry had on the whole body for anyone, and it was presumed that only a small number of women would have a problem. The committees that make the guidelines in the healthcare system tend to ignore the post-marketing studies that are done with the registries, like the FOS database and the Fabry registry. And that's where the most current and valuable management information is. So they are still referring back to the clinical trial data from the year 2001 to 2003 and relying on that, and that data is very out of date at this point. How to change that is something I am not quite sure, but that is part of the problem for sure.
Yeah, because most of the experiences that I know also from young adults report that they are referring to the guidelines. So yeah, you are right. But it was something new that I didn't know, that they were based on the clinical trials and not, let's say, also independent research. Thank you.
Yeah, they're not updating them rapidly enough, the guidelines rapidly enough based on the new discoveries that are being made. So
thank you.
Thank you. Is there anyone else that would like to comment or say something or ask any question?
Yes.
Yes, of course. Go on, please.
I would like to comment that I am a co-founder and first president of one of Brazilian's large Fabry organizations. And I work with over 500 women who report us about their symptoms. And what we could see is that many women with the LH1 mutations and classic Fabry disease, they don't feel any symptoms. They don't feel pain. They don't feel burning. But they, on the other side, they are affected in the heart and they have neurological affections. And so how could you get that if they don't have any signs of pain or anything else? How can you know when to treat them, and how can you manage their disease when we cannot see what's happening to them?
So there's a lot of patients that have no external signs. In the women with heart disease, they should be able to, with echo and MRI scans, to look at how the heart is functioning. That doesn't help you get an early start, but they can monitor, that is monitorable. They can also do monitoring of the electrical system of the heart and treat accordingly. We would like to be able to treat before that. The neurologic symptoms are harder because we don't have good ways of measuring those, and it hasn't been well studied. So we
Yeah.
need to do more work on that. But the other thing that we need to do is make sure that people have access to and are encouraged to take advantage of the treatments that we have, because it's been shown, I think, pretty compellingly that people on treatment, not only do they live longer, but the quality of their life is better than the people with the same degree, same type of Fabry disease who are not on treatment.
Thank you. Is there any way to measure if they are getting better neurologically?
At this time, as far as I know, there is not. There are people studying that. There was a woman in Wisconsin who was studying the nervous system in Fabry disease and is trying to find ways of measuring that. The pain scales that we use don't help very much. The EMGs to look at the nerve functions don't help very much. And when we've tried different tools for measuring neurologic functions and things like that, we get mixed results. And yet, when we do studies looking at do you have neurologic involvement, it's very consistent that the vast majority of people with Fabry disease do have neurologic involvement. Both the peripheral nervous system and the central nervous system seem to be involved, but we don't have good ways of measuring that at this time.
Okay, thank you very much.
Thank you. Another comment and a great idea maybe would be thank you, Dr. Hopkin, for great information. Perhaps Finn could make a book with stories from women with Fabry and what it's like to be a woman with Fabry in everyday life. And the book could be given to more doctors around the world. And so they would learn more about Fabry and women, just an idea. Is the QMRI good way to measure? I'm guessing this is a questionnaire about, I don't know.
So the QMRI is a good way of looking at it. It's just not widely available in a lot of places. So getting that as a routine monitoring thing would be very difficult, I think. I think it would be very interesting to have some studies done using that longitudinally over a population of people with Fabry disease and see if the treatment results in change. I don't know how hard that would be to get done. In the US, there would have to be a grant funded sponsor for that. You couldn't just do it, and at least my experience with it, when we have applied for grants for that kind of studies, because it's a rare disease, there hasn't been a lot of interest in it unless we had a treatment that we think can changed the outcome. And right now, the treatments that we have, most of them do not get into the central nervous system effectively. Now, that is likely to change. There are several of the newer medications that are being looked at and that do appear to have um, beneficial effects on the nervous system. So at least in the modeling that's been done. So hopefully that will be changing.
Yes, great. Is there anyone else that would like to ask, even though I think we have exceeded the time that we have?
Yes, can you hear me?
Of course, we can hear you. Yes, go on.
First of all, thank you, Finn and Dr. Rob, for today. Been very helpful. And I also wanted to thank you, pardon me, for the white paper put out. That was very helpful. And two of my docs were happy to receive that literature in print. So that was helpful to me. And lastly, I wanted to address the your question earlier about the continuation of exercise. I actually can speak very positively about what continued and repetitive exercise has done for me. First of all, I'm retired, so that makes it much easier for me to attend classes, but I've been going to pretty high intensive Orange Theory classes 4 times a week since retiring, and it has been amazing for me physically and especially mentally to continue doing that. I look forward to it every day, and it has overall helped with my endurance and strength and mentally being able to deal with pretty much everything that comes at me. So just wanted to add that. And like I said, it's much easier for me to go since I'm retired, but getting started was difficult, but I'm glad I continued and look forward to it every day now.
It's good to hear. I think that's great.
Well, thank you. Yes, I agree. Thank you very much. So if there is no one else that would like to comment or ask a question, I think we've reached the end. Sarlun, can you open the cameras, please? And as I said in the beginning, we have all recorded the webinars, so that's why I was not using any names. Thank you. And so that will allow us to upload it as it is. Okay, well, Dr. Hopkin, again, thank you very much. As always, you are a great partner to us. Thank you very much for not only presenting these results of the survey, but doing some work behind the scenes as well. Thank you very much. Thank you all. And I will see you, some of you, in our expert meeting in 2 weeks. Thank you very much.